Alright, so thanks for joining us again. This is a continuation of the last video that I just did. This is the thoracic spine evaluation. So I'll be performing some components of this evaluation for you. I will begin with palpations on the anterior structures of the thoracic spine. So this begins the most superior part at the sternum. So you can find this in between the two protrusions of the clavicles. On skinnier patients, it's easier to locate just based off of bony prominences. So the manubrium is the most superior portion of the sternum. And as you palpate inferior to that on a straight line, you'll be on the sternal body. And this goes for quite a while as it spans down their thoracic until it gets to a point where you no longer feel any bone. And when you can get your fingers underneath that, you're at the xiphoid process. So you can locate that by finding some soft tissue, putting your fingers into their body, digging up, and you'll know that you're at the xiphoid process, as that is the end of the sternum. So going from that, you can go lateral to the sternal body and palpate the costal cartilage for each individual rib, as it is the articulation between the rib and the sternum. So you can find each costal cartilage, palpate for any tenderness, and you'll also palpate in between the ribs for any tenderness in the spaces between the ribs. And you'll just want to run down for costal cartilage on each side. And you'll be administering some professionalism here if you're dealing male on female patient, just making sure that you're performing the evaluation in a way that makes the patient feel comfortable. So making sure you explain what you're palpating for, letting them know, is it okay if I perform this evaluation? So after you've done the costal cartilage down the span or length of the rib cage, then you'll want to palpate the bony bodies of the ribs themselves. So you can palpate from the anterior articulations towards the posterior. So you'll be running along first rib as it comes behind and underneath their armpit to connect to the spine of the back. And you'll do this with each rib. Obviously when you're in the area of the breast tissue, you're not going to be able to palpate the ribs themselves. So I kind of just do as many as you can feel before you run into that area. Jump below that and pick up your palpations again with the ribs as they come along. And you're just noting any point tenderness that would be indicative of a fracture or stress fracture to the rib. So you can continue out. You have the floating ribs at the bottom. They have conjoined costal cartilage that connect to the sternum indirectly. So at the bottom of the rib cage in skinnier patients, you'll be able to find that, so you'll be able to locate those floating ribs more easily. And those are all the anterior palpations for the thoracic. So then I would have the patient turn around for me. You're going to be doing the posterior palpations of the thoracic spine. So for this, you'll want to locate the scapula. And once you're on there, you can find that scapular border. And above that, or superior to that, is the supraspinatus muscle. So just palpating over that general area. And then below the border is the inferior fossa, or where the infraspinatus muscle lies. Palpate in that general area again for crepitus or point tenderness. And then the most inferior muscle on the scapula that is palpable is the teres minor, so you can palpate that area as well. And then you'll be palpating the paravertebral muscles, which are lateral to the spinal column. They span the whole area of the spinal cord, so you can start inferior, locating that spinal cord, and then palpating just along it as you are running vertical, and noting any spasms, any muscle tenderness that may be present there. And then you can also palpate the latissimus dorsi muscles, which are known as your swimmer muscles. They make this shape here on the back with your hands, so you can place them there, kind of just palpate the general area of the latissimus dorsi muscles. And then you can palpate the costovertebral junctions, which are where the ribs, once they run anterior to posterior, finally connect to that spine. So just palpating lateral to the spinous processes, making sure there's no obvious deformity that is palpable there. So that will conclude the posterior palpations for the thoracic spine. I will have the patient turn around yet again to perform passive range of motion for the thoracic spine. So for this, I will be providing the stabilization and the movement since it is passive. So I will start with a thoracic flexion. So I'll have the patient cross their arms on their chest. And I'll be providing stabilization here, and as I'm applying a flexion at the back of their body. And you want to apply an overpressure at the end, seeing for a normal end feel. The next one is thoracic extension. So again, the arms across in their chest, and you'll be applying an overpressure here, making sure it's a fluid range of motion. So that is thoracic flexion extension. You can do lateral bending of the thoracic spine. There won't be very much movement there, but you can test it. So you'll keep the patient's arms folded across their chest, and you'll be applying pressure on the shoulder, bringing them there, applying that overpressure, seeing what kind of motion they have for lateral bending to both sides. Comparing bilaterally, making sure that there is equal movement, that it is fluid, and then there's no pain. And then you can do thoracic rotation. So again, their arms are folded across their chest. I would apply the rotation myself. So grabbing the opposite shoulder, rotating as far as they can get, applying an overpressure, asking them if that feels okay. Do the same thing on the other side. If I move over here, apply that thoracic rotation. And they have about the same range of motion available, which is good. So the next step of the examination that I'll perform are some evaluations, clinical tests. So the first one is a cervical compression, or thoracic compression, I mean. So I'll be applying a compressive force at the shoulders, directly down. It's an axial force. So seeing if there is any pain in the thoracic area on the spinal cord. The next one is a thoracic distraction test. So you'll have the patient cross their arms on this one. You're going to be supporting with your leg at the back. Helps you provide that distraction force. So you'll come up here, bring them up and out, and doing this with your knee back here. Seeing if that relieves any of the symptoms. Alright, so the final test for the thoracic spine that I'll be performing is the Adams forward bend test. So I will ask the patient to stand up at this point. I will remove the seat that they were on. And for this test, it is an active test, so the patient will be performing a forward bend without bending their knees, just bending at the hips. And I will be assessing their movement, so I'm looking straight down the thoracic spine, looking for one side if it's raised or not. She seems to be pretty equal on both sides. This is a test for scoliosis, so that is the Adams forward bend test.